This is One-on-One. Hi, Steve Adubato here. We're on the campus of NJIT, the New Jersey Institute of Technology, talking healthcare in the city of Newark. Newark is at a crossroads. We are pleased to welcome our friend Barry Ostrowsky, President and Chief Executive Officer of Barnabas Health, and also Barbara Mintz, who is Vice President of Healthy Living and Community Engagement at Barnabas Health. And I would say you're my friend, but also my workout partner.
That's right.
You work out on a regular basis, and healthy living is a part of your life. You live it every day.
Yes, I do.
Which is part of your job.
Mm-hmm.
Describe your job, and then we'll bring Barry into it.
Oh, wow. Well, I think I have the best job in the world. I get to
well
do
said.
And that just wasn't for Barry.
That's right.
I get to do what I love to do, which is teach people how to stay healthy by the choices that they make and the food that they choose and exercising. It doesn't get any better than that for me.
Is it more challenging in Newark? I mean, this series is called Newark at a Crossroads, and we talk about healthy living in Newark. More challenging, Barry?
I think it is. I mean, Barbara is the embodiment of our new mission, truly. We need to teach people how to live healthier, and we're doing it for everyone's benefit, of course. But when you live in an urban setting where there's limited access to fresh foods, where there are other social pressures on the family, I think it's very difficult to have the discipline and commitment, understandably, to this new, healthier lifestyle. And it's going to take time, but it requires a champion. Barbara's an incredible champion for us. And as I say, we need to follow Barbara. I'm no poster child necessarily for Olympic athletes, but I think that Barbara can teach us all. And the challenge in Newark is to make sure we get receptivity.
Let's talk about kids. What programs are we talking about and what impact?
KidsFit actually started a couple of years ago as a way to address the obesity epidemic that we were seeing in our clinics. We were seeing children, 11-year-olds, Steve, that were 300 pounds, BMIs over 40 and 50.
Body mass?
Body mass index.
Right.
So we felt compelled to do something to help these poor kids. So we developed a program that actually teaches them how to make better choices in a very difficult environment. We teach their parents as well.
Working with the Newark Public Schools.
And now we are in the Newark Public Schools. In fact, we're branching out into the greater Newark area beyond Newark. In the fall, we have 11 schools on the docket for KidsFit. So.
How hard is it to get kids to eat vegetables?
Very difficult. You look at them and I've heard words yucky or, a bunch of different words about vegetables. But we have a garden, and it's a part of our KidsFit curriculum, and it actually sort of gets kids involved in planting their own fruits and vegetables.
You're growing food right there, part of the hospital. By the way, Newark Beth, make that connection because people think Barnabas Health big. Newark Beth
Israel Medical Center is our institution in Newark.
Well, there's a garden there.
Well, we fostered urban gardening so that you can grow fruits and vegetables that you can consume. Absolutely.
Someone might say, why is a hospital, why is the healthcare system doing that? I mean, people get sick, devil's advocate, people get sick, you come in, the hospital takes care of you. Why are you doing all this stuff?
Well, I think beyond just treating people when they're sick, I think it should be our mission to provide education to people just to keep them healthy and well and keep them out of the hospital. I know that sounds crazy, but that is the way we should be going. We are definitely committed to taking care of our communities. We have all the expertise within our four walls. We should be doing that in the community, teaching people from our own expertise and our education on how to prevent disease, how to make better choices, give them programs whereby they can actually make some changes in their own behaviors and choices as it relates to their health, get their preventative screenings, eat better, exercise more. But some of that is difficult to connect those dots because people don't realize that the choices they make can actually affect their health.
Yeah, and we've talked about this. I disclosed on another segment with Barry. I'll disclose it here as well. I've moderated a whole range of community forums that we've had that Barnabas Health has sponsored. And when I've moderated those around Newark-centric, the greater Newark area, healthcare needs, a lot of the folks around that table come from the religious community. Barry, talk about the outreach efforts to religious leaders and what it has to do with the health care of people in the city of Newark.
I think when you start to change our mission and you start to contribute to communities, you need a couple of things. One, you need champions, people who will go out and speak to the new mission and speak to the things that Barbara and her colleagues are doing programmatically. And you also need people who are respected. A champion who isn't respected isn't really very valuable in this. So when you go to the clergy in Newark, these are community leaders. These are people who are very well respected by their constituencies, parishioners, congregations. And so as we sit down and we talk about it, they help spread the word of this new mission of ours, which is not simply conventional clinical care, but improvement in lifestyle to avert illness.
Is that population health or population management, as you referred to in our other interview?
We see it as precisely that. We see it as our responsibility to contribute to the well-being of populations. And the way to do that is to help manage the population and contribute to their lifestyle improvement. It's an intrusive idea.
Intrusive.
Well, people say, why are you telling me what to eat? Why are you telling me what to do after school? And I can accept that. We typically are folks who like to make our own decisions. But what we haven't done effectively is discuss what are the consequences of bad decisions.
Higher diabetes rates. Heart problems.
Exactly.
Whole range of issues.
Exactly. The healthcare outcome data for the 300,000 or so who live in Newark is not good. And so it needs to be improved.
Yeah, real quick, Essex County. Essex County ranks 19 of 21 counties in health outcomes, a whole range of areas. And by the way, part of the thing that Barnabas Health is doing a couple of years ago when you started the Beth Challenge, what is that? Because I know that was something you tried to do internally to send a message, which has become a national model. What is it?
Well, it actually started out to be a sort of a weight loss contest with our employees. We thought we'd get 50 people to sign up. We ended up getting at 500. At the end of 12 weeks, those employees lost 2,000 pounds. So with that success, we took it straight to the community, specifically the churches, and now we're in 12 churches. And together with Newark Beth, we've lost over 20,000 pounds, lowered blood pressures. Our folks have come off any kind of medication that deals with the comorbidity of obesity. It's a way to engage people. There is an incentive to it. I mean, you get prizes at the end, but it's interesting. Most people never ask me what the prize is. They just want to go through the journey. They want to make better choices. They want the information and the education on how to do that, particularly in Newark, which really is. Yeah, they do.
They need support.
And it is a food desert, and it is also difficult to exercise on a regular basis.
Real quick, food desert means, for those who don't know?
Not access to the kinds of healthy foods that typically people have in other areas. So we need to foster not only our own urban growers, but we need supermarkets that will in fact sell the fresh foods that we need.
Yeah, by the way, as we end the segment, one of the things we'll be talking about in the series Newark at a Crossroads is the fact that Whole Foods is coming to the city of Newark, and Aero Farms, right, which is vertical farming, which we'll talk a little bit about. Listen, Newark is changing, and Newark Beth, Barnabas Health, particularly with the merger that we talked about with Robert Wood Johnson, that healthcare system, a big part of it. Barbara and Barry, thank you so much for joining us. Newark is at a crossroads, and particularly when it comes to healthcare issues. Thank you.
Thank you, Steve. Thank you.
Stay with us. We're right back from NJIT, One-on-One. Newark is at a crossroads.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this special edition of One-on-One with Steve Adubato at NJIT has been provided by NJIT, TD Bank, the Fidelco Group, United Airlines, Verizon Communications, the Northward Center, and by PSE&G. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato at NJIT has been produced in cooperation with FiOS One News.